In this episode of Ask Dr. Zach,
It coughs all night.
I am so desperate and so upset with the medical society. They can't identify my problem so that they can do something about it.
and later,
My mother and her father developed cataracts, and I was wondering if I'm next in line for them.
then on the doctor's orders,
Don't expect a pill for everything, and ask. If you don't understand, ask.
In the ER, I deal with trauma and life-threatening situations every day. I've seen it all. I know firsthand that accurate medical advice can save lives. I'm Dr. Zach, and I'm passionate about empowering people to take control of their own health. This is your chance to ask me health questions. No question too big, no question too small.
For most of us, breathing is something that happens naturally. Unfortunately, for those who have respiratory issues such as asthma, COPD, or even lung cancer, breathing can be very difficult. Shortness of breath is a common reason why people come to the ER, and there are many causes. To learn more, let's take a look at this Blausen medical animation.
Oxygen moves down its concentration gradient from the alveolar airspace across the respiratory membrane and into pulmonary capillaries. The carbon dioxide content of atmospheric air is relatively low. Because our cells make carbon dioxide, the partial pressure of carbon dioxide in the blood arriving from the systemic circuit is higher than it is in the inspired alveolar air. Therefore, carbon dioxide moves from blood across the respiratory membrane and into the alveolar airspace. The exchange of gases between the body's interstitial fluids and the external environment is called external respiration.
And we'll be right back with much more on respiratory health.
up next,
I am so desperate and so upset with the medical society. They can't identify my problem so that they can do something about it.
all this and more right after this short break.
She coughs all night. I've even come and checked on her from time to time to see if she's okay.
I had this cough for 8 years. I have difficulty breathing. I get congested as soon as I start to cough. My nose, my sinuses get filled up. I don't sleep night or day. I'm up with the cough. I went to Dublin in 2007. It was a very rainy week, the whole week. I started to cough, and I've been coughing ever since. I'm not getting any answers. I went to my doctor 2 weeks ago, and he didn't even take my blood pressure. He never checked my lungs. He didn't check my throat or my sinuses, nothing. He just gave me nasal spray, and it doesn't do a thing. I am so desperate and so upset with the medical society. They can't identify my problem so that they can do something about it. And I'm hoping that that Dr. Zach will be able to help me.
Now it's time to ask Dr. Zach.
Welcome, Odana. Thank you very much for sharing your story with us. And we could see your frustration. So how long has this been going on?
For 8 years.
8 years, okay. And I assume you've had some tests done by this time.
Yes, I had some allergy tests
Sure.
for asthma.
Yeah.
Everything came out clear. I even had a nose throat specialist have a look at it with a probe and everything else. He said that my esophagus was aggravated or something, I guess from the coughing. And that's about it. My doctor just prescribes nasal spray,
Yeah.
and that doesn't do me any good.
No.
It just gives me a headache. That's about it. Yeah.
Okay. And so, I mean, obviously you have what we call a chronic cough. You know, it's been a long time now. And you were tested for some of the most common. I mean, 90% of chronic cough are explained by one of three things. One is asthma, which you were tested for. One is postnasal drip, which the ENT doctor, I'm sure, would have thought of. The third one is GERD, the gastroesophageal reflux, so acid from the stomach. Has that ever been looked at in your case?
Yes, I'm
Okay.
glad that you actually touched on that.
Yeah.
Some years ago, one of the doctors prescribed a medication for me was to prevent any damage to my liver because of the medication that I was on.
Okay.
And I was taking it for a while, and then it damaged my, that little flap between the stomach and the esophagus. I
Oh.
don't know, what do you call it?
It's a sphincter. the
Yeah,
GE
it's
sphincter, yeah.
open continuously.
Ah.
So I was getting acid reflux
Yes.
all the time. I couldn't bend down to pick something up, it would just come up.
Right.
So then I was prescribed a medication to counteract that.
Yes.
I took that for a little while, and then I said, no, there has to be a better way, because who knows what this does. So I took it upon myself to start healing myself. And I, believe it or not, I started eating 1 apple a day.
Okay.
Regardless of what kind, I have no more acid reflux.
Wow.
Except it gets irritated sometimes now when I cough a lot.
Yeah. And you mentioned one other thing, which is that you need a CAT scan. Is that because they saw something on your chest X-ray?
Yes, I like I said, I was brought into the hospital for pneumonia. I had a high fever. It was late at night already. They did an X-ray, and the attending physician said that we can't do a CAT scan now. All the technicians have left, so make sure that your doctor gets an appointment for a CT scan for you at lunch.
Because they saw something.
Something, yes. It wasn't sure what it was. Okay.
Right.
My doctor received the report from the hospital as well. That's the normal procedure, right?
Yeah.
And there it indicated that I needed CT scan
Yeah.
to be on the safe side. This was last July. I'm still waiting. And I remind him every 3 months. Now I'm not going every 3 months anymore just to get a prescription refilled. No way.
Well, let's go back to this chronic cough, because that's what's really bothering you the most,
yeah.
right? Because there's still a few possibilities that haven't been ruled out as far as I'm concerned. I mean, even, I think we still have to consider the fact that there still may be some reflux that you're not aware of that happens, especially because when you lie down, it's easier for the
worse.
acidity to come up.
That's when I got.
And what about, have you ever had pulmonary testing, like for your lungs, like pulmonary function testing? Because that would be another thing. I mean, it sounds like something's going on with your lungs. Has the cough gotten worse since that pneumonia you mentioned?
There's something strange about my cough. It's better in the wintertime. I don't know, maybe because it's warmer in the house or something. It's worse in the summer. In the
Okay.
summer, I have a really hard time. So why, I don't know. I was trying to figure that out because I'm not a fool, you know?
Yeah.
And I know my symptoms. I know my body. I know how it reacts. So I don't know what that has to do with anything else.
Well, it may be from allergens. There's more allergens potentially in the summertime that a lot of people react to. So what I would say is, I mean, you clearly need to have some more testing done to see exactly what the problem is, because, you know, without a diagnosis, you can't really treat a problem. And
Yeah, I know.
I mean, it's obvious, your frustration about not being listened to. I mean, this is the cause of a lot of disagreements with doctors and patients, is patients don't feel that their doctor is listening to them and their concerns. And that's obvious with you. So, but clearly you need to have further testing. Number one, to see if there is some acid reflux that's persisting, because there are other things to do about it, including medication or procedures. I would say if there is an element of the postnasal drip, then it needs to be followed up. Because the medication's not working, you probably should be seeing an ear, nose, and throat specialist again to see what can be done.
Oh, he said nothing can be done.
Well, go back, or go see another one.
I'd have to have a referral.
Right.
I can't go just on my own. You know?
No. Well, there are ways. We'll talk about it. There are ways. And the other thing is whether a possibility of allergies being a part of this, because you do have some allergic symptoms. So it may be worthwhile getting some allergy testing. And the final thing that comes to mind is, you have a cough since the pneumonia. Some people get this chronic post-infectious bronchitis. It's basically just an inflammation of the lungs afterwards. And that's why I was thinking more of the lungs, whether they should do some testing for your lungs to see if it's actually from there.
because I can feel sometimes even some pain in that area, you know?
Yeah, I think
I wanted
honestly,
to see you first, and then I'm going to go and
absolutely
get an
do that,
appointment
and you
with
need to have these tests done, and you need to have the CAT scan done. You know, you find someone who's going to take your complaints seriously.
Now, Dr. Zach's prognosis.
Bodana was very concerned because she's had a chronic cough and shortness of breath for a long time. Now, her primary issue obviously was that her doctor is not listening to her, or at least she feels that way. And that is a big problem when you feel your doctor is not listening to you. Either you address it or you find another doctor. Now, for the other issue, she mentioned that she takes an apple a day. I'm not sure that that is doing much for her, but if she believes it is, then she can continue doing it. It's not doing any harm. And we have to consider the fact that she may still have some gastric acid reflux, in which case she may need to go back on a medication to treat that. Either way, she needs to go to a doctor that's going to listen to her, and they're going to have to do some more testing to see what the problem is, and thereby come up with a solution.
Now it's time to ask Dr. Zach about the most common cause of vision loss in people over 40, cataracts.
We all know that the eyes are the windows to the soul, but what happens when your eyes become a serious cause of discomfort and pain for you on a daily basis? Many times, problems with the eyes are related to allergies. Unfortunately, this is not always the case, and medical care may need to be provided. To learn more about the eyes, let's take a look at the Blazen medical animation.
The eye is the organ of sight. Photoreceptors in the retina detect light and convert it into electrochemical signals, which are sent to the brain via the optic nerve.
And we'll be right back with much more about eye health.
Still ahead,
My mother and her father developed cataracts, and I was wondering if I'm next in line for them.
Welcome, James.
Thanks for having me, Dr. Zach.
It's a pleasure. So I think we're going to be talking about cataracts, is that right?
Yes,
Okay.
both my mother and her father developed cataracts, and I was wondering if I'm next in line for them.
Absolutely. So actually, let's just start at the beginning very quickly. You know what cataracts are, I assume?
Vaguely.
Okay. I mean, basically, they're these opacities that develop in the lens of the eye. There's the lens. Okay, that's the lens of the eye. And that ends up, instead of being clear, it ends up having these opacities in it. And so people start to have either blurred vision, or they have halos around what they're seeing, or they have intolerance to bright lights, or they have difficulty seeing at night. All those things are the first signs of it. Cataracts are very common. The risk factors include things like, well, age is definitely a risk factor. There is some genetic predisposition. So you are at a little bit increased risk of getting cataracts compared to like the general population. It doesn't necessarily mean you'll get them. It's important to note, though, that it's one of the most common surgeries in the world, cataract surgery, especially in North America. Actually, in a lot of the world where they don't have the surgery, it's actually a significant cause of blindness. But here in North America, actually, the surgery is done all the time. It's very effective. The complication rate is less than 1%. And it's a day procedure. It's not even really a big surgery.
Yeah, my mother had her left eye done a couple months ago, and it went really well and very fast, and she's having her other eye done in a couple months.
Yeah, it's really not a big deal anymore. And usually they'll take it out, and usually they'll implant a new lens. Like
yes,
a new
that's what they
clear
did with
lens.
her.
Yeah, great. Now, in terms of other risk factors, because genetics, we can't control our genetics, but there are other risk factors that you can work on. Number one is UV light, so sunlight is a risk factor. So you really want to make sure to wear sunglasses with good UV protection.
Okay.
Smoking is a risk factor also. So are you a smoker?
No.
Good for you. Okay, continue to be not a smoker. And another one actually is obesity. So cardiovascular risk factor. So, and actually it's true for other eye problems too, like glaucoma and macular degeneration. Those are risk factors. So obesity and smoking are also risk factors for those as well. So staying fit, staying active, not smoking, keeping at a good weight, that will actually also be helpful in terms of decreasing your risk.
What exactly is the cataract made up of?
Yeah, it's basically made up of protein deposits. So basically, within the lens, usually the lens is totally clear. And what happens is you start to develop these protein deposits within the lens. And they can be, as you can see, they can be all over the lens. And depending on where they are, that will affect your vision. So if it's in the middle of the lens, that means the middle of your vision will be affected. If they're more on the outside, then your peripheral vision will be affected more.
And do these proteins clump together so they can be easily removed, or are they separate?
They tend to clump together. And actually now one of the more recent developments in terms of the treatment for it is they don't even do a big incision and take out the whole lens. What they do is something called photoemulsification, where they actually go in and they just break up the cataract. They use like a laser and they break up the cataract, and then they suck out the pieces, and then they can just insert the lens. So instead of doing a big incision, taking out the whole thing and putting it back in and putting in a lot of sutures, it's actually a very small incision. Most likely that's what your mom had done.
Yes.
Yeah, and it's very quick. So that's what, if eventually you do have to deal with it, and you know a few ways now, well, hopefully you can decrease your risk, then you know at least that the procedure is very effective.
Is there a regular amount that you should be getting your eyes checked to make sure?
Well, the recommendation is basically as of adulthood, around 40, you should be getting checked every 1 to 2 years. It depends on your risk factors, etc. So I would say as around 40, go see an optometrist, get checked out, and they can make a recommendation depending on your family history and any problems that you may have. But it is a good idea to get checked regularly. And so the normal, people probably know, the regular vision is 20/20. Then it goes to 20/30, 20/40. Basically, 20/20 means you see at 20 feet what someone with perfect vision sees at 20 feet. 20/30 means it's not as good, so basically you can't see, you're an extra 10 feet in terms of the blurriness.
Okay, and does my nearsightedness put me at more risk than somebody that's farsighted?
It's a good question. It doesn't really. It potentially, if you're a very strong, what we call a high myope, so you have a very strong prescription for your nearsightedness, it puts you at a little bit increased risk for some other things like retinal detachment, but it doesn't increase your risk for cataract.
Okay.
Now, Dr. Zach's prognosis.
So James came to talk to us about cataracts. He's concerned because there's cataracts in his family. Now, that does increase his risk a little bit, but there are some things he can control. Number one, he shouldn't smoke. Smoking is a risk factor for getting cataracts. Sunlight is a risk factor, UV radiation, so he needs to protect his eyes with sunglasses that block UV radiation. And obesity is a risk factor as well. He needs to keep a good diet and exercise regularly. If it does come to him having actual cataracts, the good news is it's a very common operation. It's a day surgery. He gets out the same day.
Don't get your blood pressure up. We'll be right back.
Doctor's orders are to get the most out of your visit with your doctor in the office. Bring a list of medications, bring a list of significant health issues, do your research, but don't tell your doctor the diagnosis and the treatment you want. Be honest, avoid questions right at the end when the doctor's leaving. Remember, prepare your list of questions, symptoms, and remember, there are time limitations. Bring a friend with you or a loved one, especially if there's a serious diagnosis, because you may forget. Don't expect a pill for everything, and ask. If you don't understand, ask.
Now it's time to ask Dr. Zach.
And now is the time when we take some questions from the audience. First question, please.
Hi, Dr. Zach. I want to ask you a question on behalf of my aunt. She's 72 years old and suffers from MS. And she'd like to know if you've heard of anything new on the horizon that might help her in her treatment. And she also asked me specifically to get your feelings about this process or procedure called the liberation procedure.
Yes. Thanks for your question. So MS, as you probably know, as people know, is a pretty devastating neurological disease where basically it's considered somewhat autoimmune, where the body attacks the myelin, which is what protects the nerve cells. So to answer your two questions, number one is there anything on the horizon? So certainly there is. There's always research being done. There's one I heard of just a couple of months ago called Lingo 1, which is a new medication, which it's not yet out, but I know they're doing clinical trials on it now. So if your aunt wanted to, she could Google it to see. And then to address your other question about the liberation therapy, a guy named Zamboni, who claimed to have cured a whole bunch of people of MS by opening up one of the veins in the neck. Unfortunately, up till now, all the research has indicated that it's really bunk, that it is not a useful procedure, and it's potentially a dangerous procedure because you're doing things with the veins in the neck, so the circulation to the brain is at stake. But at this time, I can't recommend that she go anywhere for it, and I don't think any neurologist would recommend it at this time, unfortunately.
Thanks, Dr. Zach.
Great question. Anyone else have a question?
Hi, my name is Janet. I'm an accountant, and I love to hike. I like to get out on the trail, and what I'd like to know is what I can do to keep my feet in shape so they can carry me through. So I'm still hiking in my 80s.
Absolutely.
Yeah.
The number one important thing I need to say is that people with diabetes especially, or circulatory problems, need to pay extra special attention to their feet. The problem is, and actually, do you happen to have diabetes?
No, I do not.
Well, so that's good for you. And it's not everyone with early diabetes, but the problem is if for any reason you don't have good circulation to your feet, then you're at much more risk for getting infections and getting ulcers. And eventually, I mean, unfortunately, diabetes is the #1 cause of non-traumatic amputations that have to be done because people don't have good circulation. For everyone else, and just in general, what can you do to protect your feet? The #1 thing certainly is footwear that is comfortable. Actually, a couple of days ago, we spoke to someone with back problems who was wearing, really high heels. I'm not a fan at all. You really need good supportive shoes, not high heels, things that support your weight well, and also ideally cushioning. In addition to that, the other thing is foot care. So certainly any foot infection, it needs to be looked at and treated. The other stuff may sound obvious, but it's still important to pay attention to. So when you're cutting your toenails, actually one thing is to cut them straight and not curved, so they don't potentially get infected, or you have a hangnail or ingrown toenail. So if you do have an infection, treat it. Keep them clean, keep them dry. Just take a look at them. And if, in some people, not you, but some people have difficulty seeing their feet because of vision problems or whatever, it's important for those people to see a doctor who will actually take a look at their feet. Thank you.
Thank you.
So that's all the time that we have for today. I want to thank our great guests, and I want to thank our great audience for some great questions. Hopefully there were some really good answers as well. And be sure to join us next time on Ask Dr. Zach.